The word depression gets thrown around a lot.
School's so depressing.
350 million people worldwide suffer from depression.
The first three words that come to my mind when I hear depression.
Depression?
Depression.
Dark and alone.
Emotional and...
I'm not sure right now.
Loneliness.
Dreariness and rain.
Gray.
Hopeless and emptiness.
Like cold, unmotivated.
Suffering. Self-hatred.
Ice cream and my bed.
Endless dark hole.
Lonely and afraid.
Sad.
Sad.
Sad. Sad.
Oh, I think of debilitating. I think of, strangely, I think also of hope. And I think of trying to get to the opposite of it, which is happiness. So those are the first three words I would say.
We overuse the word depression, like, oh, I'm so depressed, or, that's depressing. But depression is actually a psychiatric illness, a medical illness, and it's a brain disorder that's treatable.
Kids will come to me for all kinds of reasons, but depression is one of the biggest reasons that someone would come and speak to me. I'm not sure of the exact percent number. I'm gonna estimate what that number is, but depression and anxiety go hand in hand, and I would probably say that the number of kids in the building that are struggling at any given time with depression and or anxiety could be as high as 30%.
Started in high school. It goes way, way back. I was just floundering in school. I didn't know if I could even graduate. I was so depressed. But we didn't realize it was quite a depression. It just was kind of showing itself in I couldn't get up for school. My grades were terrible. I took to my bed for a week. I didn't eat, I didn't drink. I was very suicidal. I didn't sleep for 2 weeks and I became very sleep deprived, and it was an awful time. I finally was put in the hospital and they diagnosed me with bipolar depression.
Bipolar disorder is a type of depression that causes severe mood swings that include emotional highs, called mania, and lows of depression. Depression for individuals is like a fingerprint. No two are the same.
I have bipolar depression, so I not only have depression, but I get manias, and I also have generalized anxiety disorder. So depending on what combination of those things is going on, I just try everything in my arsenal and hope that one of them works. My parents have both had periods of depression, and growing up with that, it was more obvious with my mother. And growing up with that, I knew what it was, but I really only knew what they told me about it, which wasn't always accurate and wasn't always a positive spin on it. So I had a lot of negative ideas of what depression was.
If someone has a broken arm or a high blood sugar level, that's very concrete evidence that there's a problem, and I think people are comfortable with those kinds of diseases. Depression is more abstract. Those symptoms I described, there's no blood test for that. And so I think it makes people uncomfortable to consider that someone could be unmotivated or crying, and it's because of a true disease.
According to the Center for Disease Control, nearly 90% of persons with severe depressive symptoms reported difficulty with work, home, or social activities.
When I was 18 and I had my mental breakdown, pretty much what happened was I got to work one day and I just started crying. Just all day, every day, until I went home and went to bed. My boss, I pretty much got the ultimatum of fix yourself or you're fired, which is really scary when you're on your own and supporting yourself. So I did what I was told. I went to the doctor, I got a prescription, I got a therapist, and I did everything correctly. And I still do those things, and it's been effective, so I'm not stopping anytime soon.
Treatment works. The tragedy is that fewer than 50% of people who suffer this terrible, devastating disease ever get care.
I almost wish that it had happened a lot sooner, but I think my parents had a little bit of a negative view on it, so they were hoping that, you know, it was just teenage angst or something like that.
If my son or daughter had cancer, my community would rally around me. They would help me with doctor's appointments or child care. They would bring me a casserole. That's what the community does. Once we understand it, and we're not going to be talking about you, oh, did you hear about so-and-so? Stop this. Stop it. It's not a bad thing. These are real human beings that are battling a difficult time, whatever it may be in their life.
I have thankfully only actually felt that judgment a few times, but when it does happen, it's really devastating, because someone who you maybe liked or thought you had a good relationship with personally or at work all of a sudden treats you differently because they find this out about you.
So the stigma is very high, and the problem with stigma is it creates a barrier to treatment, because no one wants to acknowledge a stigmatizing disease and no one wants to get help. So there are just a few brave souls who actually seek care.
Up to 80% of those treated for depression show an improvement in their symptoms generally within 4 to 6 weeks of beginning medication, psychotherapy, attending support groups, or a combination of these treatments.
I am finally on a drug that is helping me. I've been well for a whole year, and that is huge. I've been out of the hospital, even though I've suffered from a very bad bout of physical illness. I'm doing it. I'm an example of that you can pull yourself out of a really bad life.
In 2012, 16 million Americans had at least one major depressive episode.
I don't know many of the laws or policies specifically, but I think for healthcare in general, not just mental illness, there really needs to be a revolution, and I think that will always include mental illness because it's a very big part of everyone's health.
This is a country that's, 250 years old. I've been in the legislature for 14 years. It's like that much out of this much. So what we do with it is important, and I think this is an issue that we have to enhance those opportunities and services for everybody in the Berkshires, regardless of age.